We are inside one of the rooms here at Crestwood Medical Center, part of the ACE program. The ACE program stands for Acute Care for the Elderly. And I've got Susan with us, and she's one of the experts here at what goes on at Crestwood. Now, this is a newer program. You've only been in existence for about 5 years, but it really is a very specialized group of doctors, nurses, and caretakers that specifically work with elderly patients.
That's correct. It requires additional training for nurses, so ongoing education, trying to keep everybody up to the latest with the developments that research is showing. And then, of course, working with Dr. Khan, who specializes in geriatric care.
Now, the ACE program obviously is directed strictly for elder care. What sort of things are different for the elderly versus the general population?
Mm-hmm. Well, the elderly have different reactions to illnesses. So what normally may not even bring a patient into the hospital, for example, a urinary tract infection, would bring an elderly patient in sometimes, and with that some other complicating factors such as confusion. And it's interesting that once you get that urinary tract infection cleared up, all of a sudden grandma and grandpa are back to their normal selves and ready to go back home and do the things they've always done, be involved in the social groups that they've been involved in and stuff like that. So that's really our goal, is to get these patients back to their not just their normal daily activities, but their social life.
Many times the elderly are just put on medication after medication after medication in treating certain symptoms.
Correct.
But when you specialize, like Dr. Khan here at Crestwood, they can possibly reduce or eliminate a lot of those medications, and it might even change their whole physical and mental capacity.
Absolutely. We have a lot of what's called polypharmacy. Patients come in on a lot of medications. And so for doctors like Dr. Khan, they have to sift through all of those and really weed out sometimes duplicate medications and things like that, and really get to the minimal amount of drugs the patient needs to be on. And then he manages that medication, and it can make a world of difference. A world of difference. So that, I think, is very helpful, and certainly more than just in the in their what they're ingesting, but also what's coming out of their pocketbook. We're talking about people that are on fixed incomes, and that's expensive to be on that many drugs.
Right. Well, one of the things that I've heard mentioned is that people take so much care in choosing the right pediatrician when they have a new baby, because it's a specialized medication. Geriatrics is the same way, and it's great that Crestwood has this program that really specializes in taking care of the elderly and their special needs.
And many of our doctors take care of elderly patients, that's for sure, and they do a great job. But to have Dr. Khan, who's I guess his real passion is in taking care of these geriatric patients, it definitely helps us as a hospital to have a cohesive program, to have a physician that's that interested in what's going on in the hospital is very helpful. It helps us to have that cohesive unit, to keep everybody involved, to keep everybody on their toes. The patient population that we're talking about right now is, of course, the geriatric patient. Everybody goes through stages of development, and the normal stage of development for the geriatric population is called life review. Life review is talking about yourself from the time you were a little kid until now. We take care of patients that literally have gone from buckboards, riding in the flatbed wagons to dances, to people that have now seen, of course, Man on the Moon, and now we're going even further out. That's one person's lifetime. It takes time to do that review. Patients need to talk about that. That's what our nurses and our nursing assistants, they do sometimes. You have to sit and talk to a patient. There's more to taking care of a patient than giving out medications or checking their blood pressure. It's taking that time to sit down and really be with that patient. We do have a very highly educated population, and it's not just the engineers. We have a highly educated population that is in the stages of being in a geriatric or an ACE unit. I think what's most important is that everybody see that patient as more than the person that's in the bed right now. They have a long history. They have come in ill. We want them to go home as close to well as possible. You know, you still heal once you get home. But for people just to remember, you take a little old lady that has white hair and take all of her makeup off, and her jewelry off. And the lady that yesterday was out leading a committee in the community, doing some really important social work, now looks like somebody that's old and frail. And they're really not. They're just ill for right now. So, NISH is Nurses Improving Care for Health System Elders. And this is a special certification that we get. This is one that requires a lot of education. It is ongoing for everybody involved in taking care of these patients. And that's so we make sure that we're all on the same page, that everybody approaches the patients in the same way. Obviously, everybody's got a different personality that they put into it. But the nurses that are here because this is their passion. And the fact that we're able to achieve this certification is a reflection of that passion. And the thing that I am so proud about Crestwood is that we don't just provide care for patients, we care for patients. And although it sounds a lot alike, there's a big distinction in that sentence. And that's what I'm really proud of, that happens a lot here. And we have patients that will tell us they wouldn't go anywhere else than this hospital and this unit to be taken care of, because they feel like they're being taken care of by family. And that's what we want.